All right. So good evening, everyone. Um, my name is Ibrahim, and I am the founder of Greenafrique organization. And we are glad to be here. This is actually our first activity or first event here on Zoom. So you'll be here with us. If we have any mistakes, actually know that this is our first time. We may be testing some things, but this is going to continue. So Greenafrique is an environmental organization. We have three key areas that we focus on, that is health, um, climate change, and community service. So part of our aims and objectives is to commemorate days that are important. As we all know that we are in the month of October, and in October, the whole month is labeled as the month, the breast cancer awareness month, or some call it the pink month. So for that reason, we also deem it necessary, even though our organization is just starting, but this is one of our key areas where we focus on, and we deem this necessary to organize a webinar where we are going to raise awareness about breast cancer. So in the program, we are supposed to have two people, and the first person to speak was supposed to be Fatou Bojang, but since she is not here yet with us, we can see Foday is already ready to take up the stage. So the topics they are supposed to treat. It was going to be Fatou Bojang, the first speaker, to speak on early detection and the prevention of breast cancer. And Dr. Foday Kanyi will be speaking on the understanding breast cancer and support for victims. So Foday is a medical doctor. He just graduated from the University of the Gambia, and he started his work at the main hospital in the Gambia called the Edward Francis Small Teaching Hospital. So Foday will be taking us through this topic, that is understanding breast cancer and support for victims. Without wasting a lot of time, I think we are against it here. The meeting is supposed to take over about 30 minutes, and we are supposed to start at 7:30 and end it by 8 p.m. So we are going to give 12 minutes to the speakers, and they can elaborate on their topics. And we have another guest speaker that is supposed to talk about how people in art can utilize art to raise awareness on breast cancer. So Abdul Karim Fai is going to speak on that, but we don't see him yet again. And so we can start the meeting now with Foday. So that being said, Foday, the floor is yours. You can take it up now. Thank you.
Thank you so much, Ibrahim. Like he said, my name is Dr. Foday Kanyi. I am a medical doctor working with Edward Francis Small Teaching Hospital. I am currently working with the surgical department, where almost all of these cancer cases, like the breast cancer, which is our topic today. Like he said, I am a member of the association, or let me say again, our organization. And this is our first official program, which happens to come in the month of October. And we all know that October is the Breast Cancer Awareness Month. Today, we are talking about a topic that is so important. Its importance cannot be overemphasized. It has claimed the life of over millions of people and also left others in devastating conditions. So as a result, this month, every year is celebrated, and for us to reflect and also be with the victims and support the victims in the best way that we can. So without wasting much time, I would like this discussion to be interactive. I would like it to be a very interactive one. Unfortunately, the number is not giving us that for now, but we are hopeful that we may have more people as the program goes by. So our topic today is breast cancer, and this is the most one of the most common cancers worldwide. And by WHO, by 2022, WHO, it is the most common cancer worldwide. And in the Gambia here, it's among women, it is the Gambia. And like it's so devastating when you come to the hospital and see how these patients come in a hospital. I would like to say that not any of us would like to see your relatives, your aunties, your mothers to be in such conditions. So, but what is breast cancer? As the first topic that we're going to talk about, what do we mean by the word breast cancer? This is a disease condition, a cancer. In simple terms, cancer simply means proliferation or overgrowth of body's own cells. That is what cancer simply means. It means the unregulated growth of the body's own tissues. In the body, everything that goes on in the body is regulated, is organized. Allah is marvelous. He made the body in such a way that everything goes on in a particular way. So if that right mechanism is faltered in any way, then this may lead to different disease conditions, and cancer is not different. So breast cancer, like all other cancers, it's simply the proliferation or the overgrowth of the body's own cells. And in this case, it happens in the breast. It is common in women, though men can have a just small percentage of men can get this condition, but it is actually a very common condition in women. So today, the most important point that I would like us to understand from here is what do we call breast cancer, so that we all understand what breast cancer means. The other thing would be, what are the signs and symptoms of breast cancer? So the other technical things, I will leave that for the medical practitioners, but the most important take home from here is, what are the signs and symptoms? How do you recognize this is breast cancer? What do you see in yourself to think and also have the suspicion that what I have could be breast cancer? And what do you do if you have those symptoms? So one of the earliest things, or let me say, one of the most important things you see on your body if you have breast cancer, or if you are about to develop breast cancer, is when you develop something in your breast. Like when you touch the breast, you feel like there is something inside. This is something that we need to pay attention to. Like, we can all be an advocate in our own homes. Let's say a take home from this webinar. We can sensitize our daughters, our mothers, our aunties at home, that it is okay. Though my colleague here would also talk about that when it comes to the prevention and then the other things that we should do. But here right now, I will tell you, you can be touching your own breast. We call it self-breast examination. You can be touching your own breast end of every month. That is, as soon as you see your periods, you can touching your own breast. This would help you not to see anything abnormal inside the breast. So that is what we call a lump. In this one, in a lay term, or in simple terms, it means you are kind of touching a stone sort of inside your breast. Whenever you have a feel of something like this in your breast, it is this is a marker. This is showing you something that you should seek medical attention, go to the hospital, and then find out what is wrong with your breast. The other thing that is very, very important that you need to take note of is change in the shape of your breast. The breast may change in shape completely. Sometimes it may just be only the nipple, that is the outer part of the breast where the baby suckles, for example. This part is called the nipple. So the change in shape of that nipple, it may have wounds on it, what we call ulcers on it. It may be completely deformed. So these are some shapes that the nipple may have if you have signs that may point to breast cancer. Other things may be you can have pains intermittently in your breast that may not be cancer. Most of the time, those are breast cancer. But then to be on the safe, whenever you see such signs in your condition at the old age. At old age, if you have these symptoms, the most important thing is for you to seek medical attention. Go to the hospitals. Edward Francis Small is open for all. We have other hospitals in the Gambia. Any hospital that you enter will give you direction whether you can be treated there or not, and they will direct you. So other conditions other symptoms may be you can have discharge, that is you see a fluid coming out from your breast. This discharge may be bloody. This something that is coming from your breast may be in the form of the blood or in abnormal fluid color. This abnormal fluid color, what I mean by that, we all know that women, especially the lactating ones, who have milk coming from their breast, that we all know that is normal discharge. So the abnormal discharge would be the one that is blood stained, having blood inside. That is not normal. That can never be something normal. So whenever you see such signs, even in a lactating mother, it is not normal. You actually go and seek medical attention. So we have other signs and symptoms which may be associated with breast cancer, but that is when it actually gets to late stage. But in some breast cancer, in the earlier part, in the earlier part of the disease, it doesn't give any symptom. Some of them will not give any symptom. And the symptom, the most common symptom that you will see, like I said, will just be a lump in your breast that you feel when you touch, and it's not painful, especially the painless one, cancerous lesions. They become cancers for we make and the safest thing is to on your an important part of this discussion, cancer. So there is no specific cause for a breast cancer. But the most important thing is, what are some of the things that predispose you to get breast cancer? Not necessarily having a particular cause, but there are things that when you can have this breast cancer. And the most among them, number one among them is the age. Age above breast cancer, that is the commonest time that breast cancer would appear in most women. And we all know that is something that we cannot modify. That is something that we cannot do anything about. It's just age, it's natural. And then when the time comes for the old age, it will certainly come. But then what we can do, like I said, we will come to that prevention. We will do some screenings before you get to that age so you can confirm. But then but then there is nothing that you can do about the age. So the other most important thing, what we call increased exposure to estrogen. How do we have an increased exposure to estrogen? Estrogen is a hormone in the body. And this hormone, the more you are exposed to breast cancer. And how do you, in simple terms, how do you get exposed to this hormone in higher amounts or in abnormal amounts? Having to menstruate early. In women, having to menstruate early, that's menstruation. We all know that menstruation can start as early as 9 years. In some women, the earliest age for a menstruation woman was 9 years. So it can start, but it can occur in some men as early as 9. Some it can be as late as 16. So, but the earlier you start menstruating, then the higher your exposure to estrogen increases. And also having to menstruate until a very late age. Menstruating up to a late age can also be a factor for you to increase a high amount of estrogen, and therefore your chance of getting breast cancer is high. And then the other factor, and this is something too that cannot be modified. It's not something that you can do much about unless you do proper screening. You cannot do much about when your menses will start and when the menses will stop. The other thing that we are going to, the other risk factor that we'll talk about here is going to be nulliparity. In simple terms, what nulliparity means is that you are getting pregnant and not actually giving birth and care. So meaning somebody who has never had any pregnancy before, never delivered, never breastfed, would actually have higher chance of breast cancer. So the advice in this would be, okay, that means like getting married, having children is a protective factor for breast cancer. So the other thing would be, like I said, breastfeeding, not having to breastfeed children. The more you breastfeed, the higher, the less your chance of acquiring breast cancer. So the other thing would be now about our diet. For diet, this is something that we can always modify. It's about the food that we take. The more food you take that are high in fiber, then those foods will protect you against breast cancer. But then taking a high fat diet would increase your chance of getting breast cancer. If we talk about fiber diet, we are talking about foods like orange, we are talking about vegetables and fruits. But then if you take a food, if you're used to taking foods that are very high in fiber, this would increase your chance of getting breast cancer.
Foday?
Yes.
Yes, I think time is up. We don't have much time. Can you wrap up and then we hear from Bojang?
Okay, so
thank you.
To wrap it up, the other thing that we can modify is smoking. Please, we should all stop smoking, especially. It's bad in all gender, but in both gender. In women, to stop smoking to decrease our chance of acquiring breast cancer. So for me, my take-home message would be, do what you can, modify the things that you can stop. The bad habits that you can stop with can decrease your chance of getting breast cancer, and then also improve on exercise and physical activity. This would decrease your chance of getting breast cancer. So if I have time, I will come back to talk about what can we do about what can we do for the victims of breast cancer. Thank you.
Well, thank you very much for that. That was a very interesting conversation. I was not, if there is time, I would just allow you to continue. Thank you very much. So without wasting much time, Fatou AB Bojang can come in, and then let's hear from her. Your topic of discussion would be early detection and prevention. Thank you. Hello, Fatou, are you there?
Good evening. Am I audible?
Yes, we are getting you. You can continue. We have.
Good evening. Am I audible?
Yes, you can continue.
Am I audible? Hello?
Yes, we are getting you.
Yes. Am I audible, please? Can you hear me?
We can, yes.
Okay. So,
Yes, you are audible from my end.
thank you. So, good evening, everyone. I am Fatou AB Bojang, and I'd like to take you through the prevention and early detection of breast cancer. I prepared a simple slide, so I would be able to use this. It makes life easier for all of us. I'm just trying to share my slide. Okay. Are you seeing my slide? Ibrahim, are you guys seeing my slide?
Yes, we are.
Okay. So
Yeah.
when it comes to breast cancer, Dr. Foday have made quite an amazing, a short and precise presentation on that. And I would quickly like to take you through the how to prevent breast cancer, how to help prevent breast cancer. It is actually important for us to help prevent for us to. Sorry, my laptop is just doing anyhow. Okay. So it is actually important to know these early signs that will help you detect the breast cancer early, or that would help you not become a victim of breast cancer. Because recently, the statistics have shown us that breast cancer is one of the leading cancers that is taking the lives of the ladies here in the Gambia, and it's something that we believe we can do something about it, intervening at an earlier stage. So, okay. So the first thing is to learn how to do a self breast examination, because it's one of the most important thing. As a lady, every month after your menstrual period, one of the first thing you need to do is to look at your breast and examine it yourself. So this is really something that it is very easy to do at the comfort of your own house. You don't need to go to the hospital to get this breast examination done. So immediately after your period, you can stand in front of the mirror. There is a stepwise protocol. You can stand in front of the mirror and go through this. First, what you have to do is to observe your breast and see if there's any visible changes in the breast. It can either be you see discharge coming from your breast, that is like any liquid, if at all you are not breastfeeding, or you see a mass, or we would some in layman terms we call it a stone. You see something hardened around your breast, so you can quickly look at it. You can, if you observe it and you look at your breasts, are they equal? Do you see any discharge? Do you feel any marks? And then you can start touching your breast. You can palpate it in a way like this. Here you can palpate it to see if it is something all over your breast. And you can do this with either if you're in shower or you are lying down. It makes life easy for you. So now when you pick up from this breast examination, what you get is the most important thing. if you don't see any of these changes, if you don't see a lump, you don't see a discharge, you don't see a mass, yes, you can also do the if you see a mass, what you have to do first is to go to a healthcare facility. I'm so happy with the way the Gambia is actually going through breast cancer, especially this month of October. They are trying to have as much screening as possible, offering so many free screening centers so people can have access to this. We don't need to necessarily say that we don't have a screening center or you don't know. You can walk into any healthcare facilities and the necessary referral would be done for you. So, what are some of the ways that we can prevent this breast cancer? So, one of the things that we believe is the cause of breast cancer is it's genetic. If you have a family member that died from it, especially a close member, it is actually important for you to screen yourself regularly. So, there is one screening that we call mammography. Mammography is more like a scan, but usually mammography is advised to do when you're 40 years and above. But below 40 years, you can either try the self breast examination, or if you feel a mass or a lump, you can walk to the hospital and they will take history for you from you, and then they will see the necessary things that they can do for you. It's really easy for you to do a self breast examination. I'll share this slide right after my presentation. So let's come to preventing breast cancer. So one of the ways to prevent breast cancer is breastfeeding. It's so important to breastfeed your child. I think now in the Gambia, some of us are trying to do away this method that we have, but it's important to breastfeed your child. It is so good for your breast. It can help prevent breast cancer. And smoking. There is this question asked, why is it that previously it was just the old that was getting breast cancer, but now even the young is getting breast cancer? And some of it has to do with our lifestyle. Now some of us we're using hormone medication, we are smoking, especially this shisha that people are smoking in the name of flavor, which is not actually flavor, but it has tons of tobacco packed in it. So these are some of the things that we need to avoid in order to stay away from having breast cancer. It is important to be healthy. That is why we recommend exercise. Exercise is very good for your body. Once you exercise, your body release hormones that are really good. It is stress-free hormones. You also need to check down your waist, because if you look at obesity, it is a risk factor for so many things. Eating healthy food, as Dr. Foday said, trying to take as much fibers as you can. Fruits and vegetables are so good, contain a lot of fiber, so it's you need to increase your fruit and vegetable intake and reduce the amount of junk food you take. And also try to watch out for changes in your breast. That is, if you do your self breast examination and you see any changes, you can quickly rush to any healthcare facilities and you would be given the necessary attention that is needed. And please try to avoid alcohol consumption. So most of this, if you look at this, most of this are modifiable things that has to do with our lifestyle: the smoking, the breastfeeding, limiting the use of hormone medication, the regular exercise. So these are all things that we can modify. If at all there are things that we cannot modify, that is where the problem lies. So when you see a lump in your breast, you go to the healthcare facility. They will do the necessary investigation that they can do for you. So that's why we say self examination is really important, because if